We have people just starting to sign on. If you'll give us just a quick moment to pull up our slides and give you a quick moment to sign on, we'll be with you shortly. If you're just signing on now, we're just going to give it one last minute for those who are just joining us to get signed on and comfortable, and then we'll start the webinar. Thank you so much, everyone, for joining us here today for the Case for Inclusion 2023, Making Good on Our Nation's Promise of Community Inclusion for All. We're so thankful to have you here today. I'm going to walk us very briefly through our agenda and some housekeeping, and then I'll turn it over to our first speaker. Just as a couple notes of housekeeping, the webinar is being recorded and the recording will be shared with registrants within 2 business days. That also goes for the slides as well. So if you have any questions about the recording or the slides, if you would just give it 2 quick days for us to send it on to you. If you've registered, it will come to your email that you registered with. And please reach out if you have any trouble accessing it after those 2 business days. As another housekeeping note, we do have the Q&A feature in the Zoom control panel available to ask questions of today's speakers. We'd ask that you put the Q&A, put your question in the Q&A anytime that you have it, but we'll be addressing the Q&A towards the end of the presentation today, so you have an opportunity to hear from each of our speakers before asking a question to see if we're able to answer it for you. You also have the opportunity to write into us specifically through the chat feature in the Zoom control panel to connect with any of our event organizers if you're experiencing a technical difficulty or you need just help accessing something. We do have interpreters available today, and you can also access our closed captioning by clicking on this, the CC icon in the Zoom control panel to see the closed captioning. Just to very briefly go through our agenda today, I'm going to very shortly hand it over to Barbara Merrill, who is our Chief Executive Officer here at ANCOR, for our opening remarks. And then we will follow largely the structure of the report itself, starting with a Part 1 presentation, the crisis impacting community-based services, reviewing our key data findings. We'll move next into a from the field panel discussion. We'll be inviting panelists from the field to tell us how these key metrics are playing out in today's services. Then we'll move to Part 2, which follows the recommendation section of the report, getting a little bit more into the policy opportunities to stabilize the direct support workforce. And then towards the end, we'll have the audience Q&A. We'll be answering questions that were put into the audience Q&A box. So as you have them, please feel free to pop them in there. And then I'll be handing it over to Armando Contreras to have our closing remarks. He is the president and CEO of United Cerebral Palsy. With that, I'm going to stop sharing my screen and hand it over to Barbara Merrill, who will be giving us our opening remarks. Barbara?
I'm here. Hello. Of course, at that exact moment, my laptop told me that my battery was low, so I briefly went off screen and plugged in. Welcome to our world of technology. Thank you, Lydia, for starting us out with all of the housekeeping. Good morning if you're on the West Coast. Good afternoon. If you're on the eastern parts of the country. I am Barbara Merrill. I'm the Chief Executive Officer for ANCOR. And on behalf of Gabrielle Sedor, the Director for the ANCOR Foundation, and our friends and partners at United Cerebral Palsy, I'm really thrilled to welcome you to this national launch of the Case for Inclusion 2023. This particular edition is really an exciting one for ANCOR and the ANCOR Foundation, as it marks the 5th release we've partnered with UCP on this important project. It's hard to put into words just how different the world is compared to the middle of 2019, when Armando Contreras, who you'll hear from later in this hour, reached out to me to see if ANCOR was interested in partnering with UCP on what at that time was already a well-established and well-respected research and data project. I'm really glad that we accepted Armando's invitation, because the case for inclusion has become truly one of our favorite and most important initiatives, both for the opportunity it gives us to tell the story of our field, but also for the tools that it offers advocates to add to the toolkits you use to advocate on behalf of policies that empower providers to deliver better services to more people. And so for all of those reasons, I thank you, Armando, and your entire team, especially Anita, James, and Fernanda, for the opportunity to continue this partnership. Now, if it's hard to put into words all that has changed since ANCOR first contributed to the case for inclusion, it feels astonishing to me that this is already our 3rd edition since COVID-19 rocked our worlds. If you're receiving supports, if you're a family member, if you work in our area, you know firsthand the devastating impact of the collision of the public health crisis with the long-standing recruitment and retention crisis that has plagued the direct support workforce for decades. But what this year's case for inclusion reveals is that we now have concrete evidence that these dual crises are threatening access to community services for people with intellectual and developmental disabilities. We began to see the signs with ANCOR's own research. The State of America's Direct Support Workforce Crisis 2022 found that 83% of providers were turning away new referrals. 63 were discontinuing programs and services, and 71% of case managers were struggling to pair people with available service providers, even after those folks were cleared from their state's waiting list and approved to seek services. Sure, there's always been a lag between people's lived experiences in the real world and the data that reflect those experiences, but we're now starting to see that data, we're now starting to see data that confirms the anecdotes we've been hearing all along, giving further credibility to our fears about community access for people with intellectual and developmental disabilities. For instance, states' waiting lists for home and community-based services, which started getting smaller at the beginning of COVID, is now starting to tick upward again. Perhaps more troubling, significantly fewer numbers of people with IDD are self-reporting that they have access to the community. For instance, the number of people reporting that they had gone out for entertainment in the last month fell by nearly half, from 77% of the respondents in 2020 to just 40% of respondents in 2021. Now, I don't want to steal all of Lydia's thunder, so I'll say this instead. In a minute, you're going to hear some troubling data points, but I want to be clear that there are reasons to remain hopeful. Of course, we have significant work ahead of us, but that's why in 2021, the Case for Inclusion began offering a policy roadmap for advocates and lawmakers. We wanted to identify the meaningful, movable, and manageable policy actions that would make a tangible difference in shifting the trend lines that currently depict a shrinking and volatile workforce. As you'll see by the end of today's discussion, our policy roadmap includes recommendations for both the Biden administration and the 118th Congress, as well as for state governments and for you, policymakers and advocates, because we all have steps that can advance progress for people with IDD and the providers who serve as their bridge to the broader community. That belief that we can all make a difference is squarely at the center of the Case for Inclusion, and why we bring you this report. And so on behalf of our organizations, please know how grateful we are to have you here, both on this webinar and in our fight to stabilize community services. So without further ado, it's my pleasure to turn the virtual podium over to my colleague, Lydia Dawson, who is ANCOR's Director of Policy, Regulatory, and Legal Analysis, as well as the lead author of this year's report. Lydia, take it away.
Thank you so much, Barbara. I'm going to take just a quick moment to share my screen again so I can point to some of the key findings from the report. We have to start by really taking into account the foundation in which we begin to review the data that we're seeing. And I have to start by saying some of the figures of the State of America's direct support workforce crisis. ANCOR has been diligently tracking the impact of the workforce on our ability to provide high quality services and access to the community. The workforce crisis has been something that we have experienced for decades. The lack of investment in home and community-based services, stagnant reimbursement rates that make it difficult for providers to be able to pay competitive wages for direct support professionals has been slowly eating away at the workforce. And as we can see through the State of America's direct support workforce crisis, that crisis of the workforce and the deterioration of the availability of direct support professionals has started to eat away at the very infrastructure of services. The State of America's direct support workforce crisis has been tracking the impact of the workforce on the availability of services with an inaugural report in February of 2020. And with our third report of 2022, we're able to see how that workforce has managed through the pandemic and has started impacting the ability to access services. A few of the key findings: 83% of providers are turning away new referrals. Because we have that initial survey to refer back to, we can see that that's a 25.8% increase from prior to the pandemic. As you'll see through these foundational numbers, the COVID-19 pandemic has drastically accelerated the workforce crisis. 63% of providers are discontinuing programs and services. This represents a staggering 85.3% increase since the beginning of the pandemic. And what we can take from this number is we're no longer talking about the high rates of turnover, the high rates of vacancy, which are evident in the services that are being provided. But now what we're starting to see is that services can't survive with the lack of staff sufficiency, that instead of seeing high rates of vacancy and turnover, what we're seeing is closures. We asked also, with the 63% that have discontinued programs and services, have we reached a new normal, or are there more program closures to come? And we saw that more than half of providers are considering additional service discontinuations. A few other key points that really play into the findings that we have in the case for inclusion: 92% of providers are struggling to achieve quality standards, representing a 33.3% increase from pre-pandemic. 66% of providers are concerned vacancy and turnover rates will increase with the end of the public health emergency. For the last few case for inclusion reports, when we've moved into that policy blueprint that Barbara was referring to, what we were talking about were the opportunities to access emergency flexibilities and emergency funding. But now that we have clear understanding of the end of the public health emergency, what we're starting to discuss is what happens when we lose access to emergency funding and emergency flexibilities, those emergency mechanisms that also help to stabilize the workforce. And 66% of providers are concerned that we will see an increase of the vacancy and turnover. And we know also from this report that when vacancy and turnover rates increase, closures increase also. We also asked if case managers and service coordinators were struggling to find available providers given these closures that we were seeing, and 55% of respondents that offer those services say that they are struggling to find available providers. And this really gives us the foundation for the key findings for the case for inclusion, where we saw data points that really speak to how the workforce crisis is eating away at our ability to provide quality supports and services. Nationally, there were 481,601 people with IDD on states' waiting lists for home and community-based services. That number is staggering viewed in a vacuum, but we have to note that between the last case for inclusion and this case for inclusion, that represents an approximate 100,000 people that have moved off of states' waiting lists. And while any one of these factors you could view in a narrow prospect, you have to take it into the greater context of what we're seeing across the infrastructure. When you see that 100,000 people have been removed from waiting lists, there may be an assumption that that means 100,000 people were able to access services. But as you'll find in the report, there's no consistency in how states manage their waitlist criteria. And so states have the opportunity to determine who goes on to a waitlist and who comes off of a waitlist. So you'll see that we found that just 2 states accounted for 85% of that approximate 100,000 person decrease. And it resulted from changes in the ways that states manage their waitlist, that 100,000 people were no longer eligible to be on a state's waitlist, but it did not mean that those 100,000 people were able to access services. 36 states participated in the Money Follows the Person program. If you're familiar with Money Follows the Person, it provides additional assistance for people who are moving out of an institutional setting and into the community. And 36 states participating in this program, again, is a wonderful thing to see states investing in and giving an opportunity for people to access the community. But taken into the larger context, 36 states is the result of a decrease in state participation in Money Follows the Person. Over the last 5 years or so, we've seen a trending decrease in states participating in this program, from a high of 44 approximately 5 years ago. We can make some inferences about why states might not be participating in Money Follows the Person. We can look to the ways that we're seeing access to services diminish. So moving people into the community does not necessarily mean they're able to access the support that they need to thrive and integrate into the community. We also can look to the fact that Money Follows the Person is a short-term authorization. There's no permanency to the program, which may go into states' decisions to continue participating in the program if there's no assurances that the program will continue. State funding for supporting families of people with IDD increased by just under $1 billion between 2017 and 2019. So what we're seeing is an increased reliance on family caregivers to provide support for people with IDD. Again, when viewed in this larger context of the workforce crisis and the deterioration of people's access to services, it makes sense that we would see a higher reliance on family caregivers. This also is exclusive to 2017 to 2019 until we have more recent figures, but we know also that states took advantage of emergency flexibilities to be able to integrate paid family caregivers into their home and community-based services waivers. So we would expect to see new data in the coming years that tell us a little bit more about how much reliance we've really taken of family caregivers in light of the workforce crisis. 22% of people with IDD who receive employment or community integration services were participating in integrated employment. This is also another figure that's really important to take into this larger context because we've seen this number stagnate across the last few reports of the case for inclusion, that we're really not seeing an increase in the people with IDD who are participating in integrated employment, although we know the enormous benefits that participating in competitive integrated employment may have for people in terms of their ability to access the community and their longevity overall. And with that, I would love to turn it over to our panel discussion. I'm going to close the share screens and we can really get into a discussion of what these high level figures look like when played out in the community. So I'm going to stop sharing my screen and ask that our panelists come on screen. I see you there. Thank you so much for joining us. I would love to just start by prompting you each briefly to tell us a little bit of an introduction to yourself, to the services within the organization that you offer, and some of your initial thoughts about barriers to accessing home and community-based services in the community. With that, I'd love to open it up to Diane.
Good afternoon. I'm Diane Beestrom, and I'm President and CEO for Koinonia, a provider of services to people with IDD since 1974 in Northeast Ohio. I've been with Koinonia for 36 years. I also serve on the board for OPERA, one of our Ohio State trade associations, and I have the privilege to serve as the president of the ANCOR Board of Directors. Koinonia provides the array of residential services from small community-based licensed group homes, supported living, HCBS funded services, respite, and shared living. We also provide adult day, vocational employment, transitional youth services, non-medical transportation. Koinonia currently serves over 300 people and employs over 450. Both numbers of people served and our current staff are significantly fewer than was the case in 2019. I'm sure others share a similar story. I'm deeply concerned about the significant challenges to access to services that are desperately needed by individuals and their families. As I see it and hear reported by my colleagues, the biggest barrier to accessing services is the workforce crisis. Providers are not able to respond to requests for services because there are simply not enough staff to do the work. Thank you for inviting me to participate in this panel.
Thank you so much, Diane. Greta, would you like to go next?
Good afternoon. My name is Greta Robinson. I am a licensed master social worker. I am currently employed by United Cerebral Palsy of South Carolina. I have been in the disabilities field for more than 20 years, working with individuals with intellectual disabilities. I also have experience working with children's services and also in the hospital field in case management. Currently here at United Cerebral Palsy, we do operate community training homes. We also, both 1 and 2, SLP, supported living programs, where we provide services to individuals out in the community. And we also operate a day services program for not only our residential individuals, but also for individuals from the community as well. The biggest barrier that I see is the fact that since a vast majority of the individuals seeking services are dual diagnosed, the workforce crisis makes it even more difficult to provide meaningful, progressive, and effective assistance and services. If there's not enough staffing to provide for individuals who are high needs for various reasons, then it presents a problem for providers to be able to provide those services to those individuals.
Thank you. Yadira?
Hey there. Hello, everyone. Good afternoon. I'm Yadira Holmes. I'm the Director of Government Relations for Consumer Direct Care Network. I'm also on the ANCOR Board of Directors and serve as the Government Relations Co-Chair. Consumer Direct Care Network has been in existence since the 90s. We are based in Missoula, Montana, and provide services in 15 states within HCBS, Medicaid waivers, etc. We do traditional agency-based services, but we also do several services in the self-directed space. That's really our niche and what we do the most across our state network. We do respite services, some community supports, and those things as well. One note I always like to share is Ben Bledsoe, our Chief Executive Officer, started as a direct support worker. And so we certainly take great pride in the care that we're able to provide, having known that many of those on our executive team and throughout our organization started in that workforce. I think the greatest barrier is I join my colleagues with the same kinds of notes. The workforce crisis is certainly something that we are dealing with on a day-to-day basis. And it extends not only to those who are providing support in the home, or providing community supports for those that need it, but it's also administrative staff who are having to also kind of take in and, cover shifts or take care of others, and they're feeling the pinch as well. They're feeling the stress. They also feel, one important note for this workforce is that it's a workforce that is incredibly caring. They do this work, they believe in the work. And we had a caregiver recently share with us, if it's not me, then who is going to provide that care and those services? And so you're also dealing with a workforce who is, having to make very difficult choices. If I'm not taking care of the person that I get to work with and support on a daily basis, then who's going to do it? But I also know that I need to support my own family and, those things as well. So I think we're feeling the pinch across the spectrum, whether it's, our direct care workers, they're, the people that they're serving and that we're supporting, or, administrative teams as well that are also facing some of the issues within the case for inclusion.
Thank you. Each of you spoke in your remarks about the workforce crisis and its how it's impacting people's ability to access services. I was hoping that you could speak a little bit more to how the workforce crisis has impacted your organization, and if you saw any increase in the workforce crisis or impact from the COVID-19 pandemic. Love to open it up to thoughts.
Well, I'll jump in there. As you already mentioned, Lydia, the 63% of community providers have discontinued programs or services due to insufficient staffing. Here in Ohio, it's been recently reported that agencies that employ DSPs served almost 2,000 fewer people in 2022 compared to 2019. And that's contrasted with an average increase each year of 1,000 new people served between 2014 and 2018. Meanwhile, the numbers of people needing service is on the rise. So Koinonia, we also closed programs, and it was always due to staffing concerns and being able to ensure quality care and health and safety. We've also been forced to discharge people, move them into locations that they had not planned. And in several cases, we've had family members who have become shared living providers, not because that was really their life plan, but because that was necessity in order for their loved one to get the care that they need. So we're just really frustrated by our inability to respond to the needs of those seeking services. Our day services have not been restored to pre-pandemic levels. And instead, we serve about 1/3 of the number of people that we did back in January 2020.
Yeah, I can chime in next. Certainly all of the things that Diane shared as well. I think for us, we've been lucky so far in that we have not had to close any types of services. However, that doesn't mean that there are folks who are waiting to access services or waiting for workers to be able to come into the home. And so we are dealing with some of those issues. One of the other areas that we found, through the COVID pandemic and especially after, is specifically in rural communities where it's already been hard to access workers and to support the workforce. We're finding that a lot of providers are deciding that they want to leave the Medicaid system entirely, leave the state entirely, and shut their doors, which then adds more pressure to those providers that remain, trying to galvanize around those workers, but realizing that they may not be able to. So that leads even to more folks not being able to access those services. Again, we're seeing some secondary issues pop up as well, where, if there can't be a consistent support, then you find that some of our populations and those that we serve are starting to deal with issues of, sadness, isolation, not doing the same kinds of things they might have done previously in the community, which is leading to some behavioral health challenges and other things. So as the workforce crisis continues, we continue to see where it's causing some secondary issues. We're losing providers in several of our states. We're trying to figure out how to manage in rural communities where access may not be as easy. And it just continues to be an issue, throughout the continuum.
If I can just continue that, those medical and behavioral issues that you were speaking of just a moment ago, again, it just goes right back to the idea that once those individuals on that critical list that have those behavioral issues and medical issues, if we're not able to provide those additional staffing in each home for those individuals, then a lot of times we have to say, no, we can't provide services to this particular individual. And it causes a frustration, not only for case management, but for the families involved as well.
And I'd just like to add that even for those that we are serving, you might say, well, at least there are those that are getting their needs met. But the reality is they all have far fewer opportunities to be actively engaged in the community on a regular basis, as was the case there pre-COVID, just because doing so requires a staffing level that's just very difficult to achieve and to maintain. So there has been a negative impact on those that are receiving some services because their life is very much changed because of the workforce crisis.
Thank you. One of the things that the report goes into, both in our calls for the data that's available and our requests for policy initiatives that would expand access to data, we start to discuss in the report the places in which we don't have the data about the workforce itself and how it fits into the larger direct care worker model. I would love if anyone had any thoughts about how addressing the workforce crisis is a matter of addressing equity issues. I'd love to open it up to thoughts.
Well, I'll just comment here. So we know from our experience, and the report points this out as well, that the majority of direct care workers are women, often single heads of household, people of color, immigrants, and in Ohio, where during recent budget testimony, it was pointed out that while the poverty line for a family of four is $13.34, the average starting rate for a DSP is just $12.10. And it's estimated that 18% of Ohio direct care fall below the federal poverty line, with an estimated 44% receiving public assistance, 25% receiving food and nutrition assistance, and 32% on Medicaid. So Ohio, I'm sure, is not alone in these statistics, but you can see that the majority of our workforce, its composition and the poor wages is certainly something that needs to be addressed, and in my mind is a matter of equity.
Yeah, absolutely. And I would chime in as well. I think what we see in a lot of our communities are there, we have significant cultural families who believe that home is the best place. And so, they're making that choice that they want to care for their loved one in their home. And it's a matter of their cultural awareness and their cultural, upbringing. And so the challenge becomes is, do they choose to help and support their family with a wage that may be much lower, without the benefits that may come with that, and leave a position that they may have had because they're feeling that tug of, I need to take care of my family member. That's the only way they're going to get care, and those kinds of things. So you then start to see kind of an economic issue, right? You're taking people out of one workforce into another with lower wages, lower opportunities. And so without that investment of dollars, then we're finding that that workforce is just not going to continue to grow. And one other thing is, I think when I look at our own company and I look at the folks who have been able to grow into leadership positions, whether that's into manager positions or administrative positions, many of ours started in that workforce as DSPs, and they have created a career path, and they have had to move into these other positions to be able to make a little bit of a higher wage. But even then, it's still very difficult, and they're being challenged with what we're able to have. One thing is, we always say to folks, we are rate takers. We don't set the rates. We take what's given and then we try to make it the best possible. And I know everyone on this call, my colleagues included, try their best to put the workforce first and to provide for those wages. But without that investment of dollars, we're going to continue to see those equity challenges. And I think it affects a lot of sort of cultural populations a little bit more because of that connection to home and because of that, just sort of the cultural norms that exist for them in their homes.
Just to chime in here, speaking from a personal point of view, I started off as a direct support staff 20 years ago. And for the majority of that time in direct support staff and middle management, I myself had to obtain a second job to make those ends meet. So when you talk about an historically marginalized population of individuals, starting off in middle wage of $13 an hour, it presents a sense of difficulty for your staff members. And then you have a group of direct support professionals who are tired, who are distraught, who are weary, and that doesn't make a positive environment for the individuals that we are serving. So that aspect also has to be examined.
Thank you. As our report moves into policy recommendations and a blueprint for how we can move forward, I was hoping you could speak to how important federal and state policy is to addressing community inclusion for people with intellectual and developmental disabilities. How can federal and state policymakers make a change in what's happening? How important is their voice?
Well, I'll kick it off. Their voice is essential and it's crucial. And I think it was Yadira that made the comment about, and Greta mentioned it as well. We're relying on Medicaid, and we have to make do with what Medicaid offers to us. And so we look to the state and federal government to address the insufficiency of the Medicaid rates, how those rates are established. Are they monitored over time? Are they kept current with economic conditions? We know they're not at this point in time. One of the issues that we we face all the time is that what is a direct support professional? What is that job? What does it mean? It's often just misunderstood if it's known at all. And so we really need for standard occupational classification to be established in the U.S. Bureau of Labor Statistics, so that this unique job, which is different than others that it tends to be compared to and data extrapolated from, that is not a true comparison and relevant to the job, so that it can really be tracked and so that we can really take a look at where does the DSP workforce stand, and how do we make sure that it is kept appropriate levels of compensation and reimbursement for that role.
Yeah, and I would chime into that as well. When you look at how states determine their rate methodologies or how they're going to determine, state and federal is incredibly important to this process. When you look at how they're going to do that, they often look at SOCs or standard occupational classifications to determine where that starting point is. And so I think that's a critical place where you can add some consistency across multiple states, across the states, if there is a classification that dictates what the work is, how the work is, and what those wages are, because then that will determine a better methodology when they're setting those rates to understand what that actual job is. Currently, the way states do it is a lot of times they pull from 2 or 3 different classifications, which might not always be the exact work or the exact level of care or support that's being given. So I think that's super important. I think, I will say that there has been some things, there's little positive things across state and federal government. There has been a better view on HCBS and its essential work in our communities as well. States through the pandemic, whether we want to see a little bit of a bright spot in there, was this, opportunity to do some flexibilities, to try some different things in some of our states. And we are seeing that states are looking at those and saying, why don't we just make these permanent? They seem to work. It might, help us moving forward with HCBS. And so I think those conversations need to continue. There needs to be consistency on how we, apply this profession and how we work within this profession, because I think that will add a lot more to that conversation and to solutions into the future. But they have an incredible voice in all of this.
I think my colleagues have summed it up very nicely, but I just like to say, to me, sustainability, quality equals sustainability. And quality services means putting the money behind it, right? You pay for quality, you pay for things that are going to last, that are going to be sustainable. And sustainable, that just is simply to me is quality. And providing those quality services means pushing our legislator, those congressmen, to make those right decisions on both the federal and the state level to get that funding for home and community-based services.
Thank you so much. We've really come to the end of our time for the panel discussion, but I really appreciate your thoughts. You can see from our participants thumbs up and hearts that they appreciate them as well. Thank you so much. I'm going to take a quick moment to transition back to our slides, and so much appreciation for you all. With that, I'm going to hand us over to Elise Aguilar, who's going to walk us through some of the recommendations from part 2 of the report.
Thanks, Lydia, and hi, everyone. Thank you for letting me be a part of this conversation today. Wanted to I think the latest question, or the last question on the panel, really all of the panelists, Greta, Yadira, Diane, you all did such an amazing job of talking about these issues, how they impact you, and what those policy solutions can and should be. So you set me up very well to talk about this next section, and this is all included in the report. I think I saw a question earlier about, we're describing the problem. We're not telling you anything you don't know. You know the dire situation that we're in, but what are the solutions? What can we be pressing our policymakers to do? And so this section is to get at that, and we're going to outline those recommendations at the federal level, at the state level as well. Going to start with recommendations that we are asking of the Biden administration. So the administration side of policy. So the first thing that we are recommending is that as states and providers are grappling with the end of the COVID-19 public health emergency, the ending of those flexibilities that we talked about that have eased things from a workforce standpoint on providers, we are looking to and asking for additional guidance to be provided to specifically address those workforce related regulatory flexibilities, to make sure that states know what the end of the public health emergency looks like, and asking also for those specific emergency flexibilities that are workforce related to be made permanent. We're also asking for the administration, for CMS, to require states to establish systems of access monitoring that compel regular reviews of reimbursement rates. I know we talked about this at length already, but as Yadira said, being rate takers and being totally reliant on these rates and the impact that stagnant rates have had on wages, on the ability to retain and recruit workforce, obviously having regular reviews of reimbursement rates is critical. And then also requiring state and federal agencies to collect and report on measures related to the workforce, looking at workforce volume. So, specifically how many people are in the workforce, stability metrics, looking at vacancy and turnover rates, and then also compensation, what those wages are. Without that data, it's really hard to address and to actually know what the extent of the crisis is. So moving on to the next slide. Thank you. So these are our recommendations for the 118th Congress, which, as we know, just kicked off last month. It seems like it's been longer than that already in some ways, but kicked off last month, a new Congress. We are asking for Congress to first and foremost to give additional funding for the HCBS program. So we're asking for appropriate funding to rebuild the DSP workforce as well as broader HCBS infrastructure. Many of you are probably familiar with the Better Care, Better Jobs Act. That's one piece of legislation that we support that's been reintroduced this Congress, which would make a very big investment in the home and community-based services program. And it would also address workforce. So it would require investments in the workforce. It would also require regular rate reviews. This is the piece that we saw the president include in his American Jobs Plan a few years ago. That $400 billion investment was, of course, then part of the conversation last Congress through the budget reconciliation legislation, which did not ultimately pass. But we're back here again, continuing to push for that additional funding for the home and community-based services program. We're also asking Congress to prioritize funding to incentivize the development of a DSP pipeline program. So, of course, again, recognizing that in addition to increasing federal match rates and investing in the program itself, there could be avenues to investing in specific measures to recruit, retain, train the workforce, specifically grant programs through the Department of Labor, through the Department of Health and Human Services. These are all, again, pieces of legislation that have been introduced in prior Congresses. We expect to see introduced again in this Congress, and that we will be supporting. And then this last piece, I am so grateful to Diane and Yadira for already previewing what this is, asking the U.S. Bureau of Labor Statistics to establish a standard occupational classification for direct support professionals. Again, this is simply a way to ensure that we're gathering the data on the DSP workforce. Without that data, we don't have an accurate picture of what the workforce looks like across the country. And also, of course, that piece that we've already talked about, how that ties into states' ability to determine their rates and their wages for DSPs, how they rely on a standard occupational classification to inform those wage assumptions and those rates. Without a standard occupational classification for DSPs, we simply have a really sort of messy system from state to state, and creating a standard classification for DSPs would go a really long way in stabilizing those wage assumptions from state to state. Before we move to the next slide, sorry, just wanted to highlight that, all of these things we're talking about here that we're asking Congress to do, I wanted to note the backdrop of where we are in this Congress. There are obviously ongoing discussions about a debt ceiling, about what spending levels will be once the president puts out his budget and Congress picks up the appropriations process. And we know that there are talks about whether there could be cuts to the Medicaid program, specifically certain members of Congress asking for cuts to the Medicaid program. And just want to reiterate that the ability to talk about our services, to continue to raise this issue in Congress and why Medicaid funded services for people with IDD are so important is really critical to the work that we're doing. It really underpins all of these other asks that we're making. And wanted to highlight that we will have, ANCOR will be putting out an action alert later this week that we will be sharing far and wide. So if you're thinking, how can I take action? How can I reach out to my members of Congress? How can I let them know that these things are important? Please stay tuned. We will have more on that to come, but want to make sure that we're providing a way that you all can reach out to your members and say, hey, these services are important. You need to know why they're so important, why Medicaid funded IDD services need your support. So please stay tuned for that. Okay, next slide. Great. And these are the recommendations for the states, again, that are included in the report. So we're asking to prioritize funding opportunities that strengthen the direct support workforce while considering measures that expand access to services. Also asking to establish systems that provide regular review of Medicaid reimbursement rates to ensure payments that stay current with the increasing costs of service delivery and safeguard access to quality home and community-based services. So it's not enough to simply review the rates, that they must be adjusted accordingly and make sure that those rates are ensuring access. And finally, this is a piece again about data collection, but there is the National Core Indicators State of the Workforce Survey, which does look at the DSP workforce, but states have to voluntarily opt in to this, this reporting metric through National Core Indicators. And so if this were made nationwide, every state participated in it, we would have a much more robust data collection system. So that's it.
Thank you so much, Elise. Sorry, having a moment trying to move the slide along. So what can you do as providers, advocates, participants, people interested in helping move us towards a better system of community inclusion for all? You can visit the Case for Inclusion 2023 website at caseforinclusion.com. You can visit .org, my apologies, to access stories, data, and other resources beyond the key findings report. You can also download the key findings report there. But it truly is an incredible tool to looking at what's happening in your state. How does your state measure against the other states in a broad national statistic? And the website is live now. So please, again, caseforinclusion.org. You can also visit the ANCOR amplifier at amplifier.anchor.org to lend your voice on specific initiatives where we have ANCOR action alerts that are available there to make it easier to reach out to federal and state policy officials. You can also connect with your UCP affiliate in your community at ucp.org to find out how you can get involved at a local level. Did see a couple of questions in the Q&A box asking about how to get involved. And so please, again, visit the caseforinclusion.org, use the ANCOR amplifier to see what action alerts are out there, and connect with your UCP affiliate. So with that, we would love to stop and take just a couple of questions. We have just a couple minutes here. I would ask that the speakers turn their cameras back on, just so that we have a showing of who's in the room and who might be able to answer some of these questions. I want to note just also that quite a bit of the Q&A is filled with support for our speakers today, both in the personal sentiments that they shared and also for the data findings. So thank you. We really appreciate that feedback. One question asks, in general, I'm interested in presentees addressing whether or not an increase in wages, offering a living wage with benefits, would begin to address this issue. And I presume that's the issue of the workforce crisis. So I'm hoping, said another way, how important are wages to this discussion, and how can these federal policy initiatives address the issue of low wages?
Clearly, wages are a significant contributor to the workforce crisis. We are not funded at a level that allows us to offer wages that are competitive with fast food and big box stores and retail. And I regret even comparing the DSP work with those kinds of jobs, because clearly it's far more significant in its consequences and complexity. So, certainly being able to compete and increasing in wages will make an impact, and it will be positive. I don't know that we can say with confidence that it will solve the problem, because the problem is very complex, but certainly it's a critical element to moving in the right direction.
I would add to that also, we've spent quite a bit of time talking today, and also you'll see in the report the importance of reviewing reimbursement rates, that reimbursement rates are truly the indicators of how much a provider can pay for a service, how much they can pay direct support professionals to provide that service. And you'll see also in the report and in our recommendations to create a standard occupational classification for direct support professionals, that states really look to the federal government to help provide them with a basis of how much a direct support professional should make in terms of wages. And so they use those standard occupational classifications to justify how much of a rate should go into wage. And so not only is it important that we are continuously reviewing reimbursement rates to ensure that wages are staying competitive, that the rate is keeping up with inflation, that it's addressing changes in the marketplace, but also that we're using good foundational tools that are recognized federally and nationally to help us track the trends that are happening in the direct support professional field and make predictions about how to support it in the future. I want to make just a quick note, because we are coming close on time, that there were quite a few requests in the Q&A, which I will direct to our panelists, asking for some more specifics on the statistics that you quoted for your state specifically, or your organization specifically. So I just wanted to share that I will pass those on to the panelists and connect you as we have the opportunity to. This hour has just flown by. It's been so incredible to hear from each of you and your thoughts on the case for inclusion and your thoughts moving forward. But I would love to hand it over to Armando to give us our closing remarks.
Thank you, Lydia. Good afternoon, everybody. Before we close out today's program, I just wanted to offer a few brief closing remarks, and I promise to keep this short. First, let me acknowledge some people without whom this report could not have been completed. I want to thank my esteemed colleague from ANCOR, President and CEO Barbara Merrill, who you met at the top of the program, for the continued and vital collaboration between ANCOR, the ANCOR Foundation, and UCP. I want to thank you and your team, Barbara, for this collaboration, for your leadership on this project, and for the leadership you exhibited across the arena throughout the years. And thanks to Gabrielle Sidor, Director of the ANCOR Foundation, for this vital collaboration. I also want to thank the 2023 report primary author, ANCOR's Director of Policy, Regulatory, and Legal Analyst, Lydia Dawson, for her hard work. And let me also acknowledge ANCOR's Vice President of Communications, Dr. Sean Luchtefeld, and UCP Communications Coordinator, James Garcia, both of whom provided editing and research support for this report. Sean is also the person largely responsible for building the informative content and background materials you'll find on the report's webpage at caseforinclusion.org, and where you can also find the PDF copy of the report. Thank you, Sean. Thank you to this year's Case for Inclusion Steering Committee as well. We appreciate the time and energy that you've committed to this project and are grateful for your invaluable feedback. Finally, my thanks to everyone who works at UCP, the 56 affiliates across the United States and Canada, for their critical life-saving programs and the loving care for people with disabilities, which serves as an impetus in great part for why we publish the Case for Inclusion every year. In many ways, the Case for Inclusion 2023, in terms of its quality and the insights it offers, is our best work yet. At the same time, however, this year's report paints a very disturbing picture. There's no way to sugarcoat this. As you've heard today from our expert presenters, the system is teetering. Simply stated, a dire shortage of workers translates into an equally dire shortage of care. The main challenge is Medicaid reimbursement systems that doesn't meet the needs of the population and the workforce it serves. And because of our nation's long history of underpaying and undervaluating the contributions of this essential workforce, which, as all of our panelists alluded to, consists mainly of women of color, other marginalized communities, and now a growing contingent of immigrants. Thank you, the panelists, for being part of today's important conversation. So where do we go from here? Ultimately, this report and everyone you heard from today are here to make the case that people with intellectual and developmental disabilities must be acknowledged and seen for the breadth of their humanity and fully valued citizens and contributors to this great nation. That's where it starts, by respecting people with IDD and by respecting their reality. Our responsibility as leaders, service providers, administrators, researchers, and as fellow human beings is to demand that much more be done to improve their quality of life. To make this happen, we need to lobby consistently for legislation at the state and federal level that directly addresses the challenges outlined in our report. Beyond that, nonprofits who serve IDD population also need to innovate by exploring alternative funding sources. Foundation grants and corporate underwriting are important and viable options. The creation of social enterprises as models for raising additional revenue is another source that many of UCP affiliates pursue. And there's a compelling case to be made to knock on the doors of individual donors who make up 80% of the philanthropic contributions in the United States. Most importantly, we must broaden our awareness that caregivers need our support. As the president and CEO of United Cerebral Palsy, I pledge to continue the fight for access, equality, and inclusivity in the disability community, and know that many of you who've chosen to attend today's important conversation are willing to do the same. Thank you for joining us in this fight to support direct service professionals, the workforce, and the people they help. And again, my sincere appreciation to our partners at ANCOR, the ANCOR Foundation, for their collaboration, dedication, and commitment to this very important project. Have a good afternoon, everybody. Thank you.
Thank you, everyone. If there's anyone just hanging on as we close out, just a quick reminder that you will get a copy of the recording and the slides to the email that you registered to. If you have any questions, please feel free to reach out to us. And you can find a copy of the report at caseforinclusion.org. Thank you so much, everyone. Have a great day.